Did you know that 1 in 4 athletes who had ACL surgery re-tear that same ACL or tear their opposite ACL when returning back to sports? And we're going to go over the top 5 reasons why it happens. My name is Dr. Marco Lopez, doctor of physical therapy and certified strength and conditioning specialist and co-founder of the Basketball Doctors. So let's jump into it, guys. The top 5 reasons why athletes re-injure their ACL or tear their opposite ACL and the things you need to be working on. So the first reason is strength. You'll be surprised how many people overlook this, and this is the most common thing we see in the clinic when we start to take over athletes' plan of care as they're getting back to sport, but making sure you have the right strength testing, the strength numbers before going back to sport. So a lot of the times we see athletes get cleared and go back at 90% or 85%. Big thing is you want to get to at least 90% of your strength. At least we want to get to 95, 100%. Why do you want to have that 10% difference as you're going back to sport? And the muscles we want to test are the quadricep muscles, the hamstring muscles, the glute muscles, and the calf muscles. And the big thing with these numbers, they're kind of thrown off because when you test your strength, you're testing your opposite leg. But the opposite leg throughout this rehab process might have gotten weaker because of non-use early on. You know, for the first several weeks, you're not using the leg, or even before the injury, you're not really using the leg as much as you used to. So in the ideal world, you want to have your strength testing baseline before you have ACL surgery on your opposite leg. That way you have the numbers of your uninjured leg to really use that as your baseline, not just the other uninjured leg. The other thing, if you're not able to do that, is having a physical therapist who has averages or data. That way they could compare that data to see if you're in the norm, because comparing to the other side might not be as beneficial because of the weakness of the opposite leg. But that's why we tell people we don't want to aim for just 90, we want to get closer to the 100%. But we see a lot of people getting cleared at around that 85 or when they're just touching 90. So big thing is really work on getting back your strength 100%. The next reason number 2, is now that you got your strength down, you got to work on your movement mechanics. So the big thing is that a lot of people work on just the strength and not work on their movement library or movement efficiencies. So when you're going back to sport, you got to be able to move well, especially after an ACL injury, because you have a lot of these non-contact injuries where you're doing, let's say, a Euro step, or you're stopping and you're trying to change direction or cutting and your knee just gives out. So the big thing is really working on these movements throughout the rehab process so you become much more efficient and confident in these movements. And we're also working on these movements planned and reactionary. So planned meaning you cut out a certain direction, and then unplanned is you cut in response to an external stimuli. So making sure you work on all the different movements you're going to be doing in the sport that you want to get back to, in a rehab setting, controlled setting, then in a chaotic setting, then on the field. That way you ensure the proper recovery and decrease your risk for those ACL non-contact injuries. Reason number 3 is rushing back to sport. I think a lot of the times we see on social media or just online that, hey, this person got back to playing sports after 7 months following ACL surgery. And the research just doesn't support it. There's such a big drop off. If you wait at least 9 months and you go back to sport, you lower your risk for an ACL injury. And every month you wait longer, the lower you have to re-tear your ACL. So the big thing is you gotta wait at least 9 months. And the reason why is not only because of tissue healing, but also it gives you more time for the knee to really feel the same as it was before the injury. So getting your strength, working on your movement, and really just getting that tolerance for the knee to withstand all the activities that it needs to withstand in your given sport. So make sure for all the athletes out there, it's not a race. You're not competing with anyone else. You're just competing with yourself, and just take your time and hit the milestones. And the big thing is we normally don't go by month timeline, but for one of them we do, and that's we have to wait at least 9 months before going back to sport. A lot of people say like, hey, wait, 3 months, you can start jogging. We have other milestones with that, but with the sport, you have to wait at least 9 months. You hit all your milestones at month 8, we still recommend our athletes to wait at least that 9 months to go back to sport. Reason number 4 is skipping the return to play testing or return to sport testing. So a lot of people, they might get cleared by their MD at month 9. They're like, hey, go back to sport, and they just go back to sport. But the big thing is you want to have return to sport testing. And these testings include the strength tests that we talked about earlier in reason number 1. And we're testing not only the injured leg, but the non-injured leg as well. So we got to make sure our numbers are really strong compared to a normative value, not just to the uninjured leg. We also want to go through movement testing. So we want to go through cutting, and we want to do some jumping, some hop tests, some single leg vertical jump. And we want to test this on both legs. And we want to make sure not only are your numbers good, but the way you jump and the way you move are putting you at less risk for an ACL injury. Are you collapsing into valgus when you're cutting, meaning your knee gives in? We want to fix all that, and we go through, and we're able to fix that by going and running through these movement screens to make sure you're moving at the most efficient way possible and decreasing your risk for injury. And also there's other sport testing that we need to do specific for the sport. So for basketball, we're also going to do, even a T drill, even a 5-run shuttle to the cone. So there's different little testings that we want to do sports specific that we use ourselves with our athletes to mimic the demands of the basketball court. And this is all part of the plan of decreasing your risk for another ACL injury. So the more we test, the more we find out any of your limitations. So when you go back, you're fully confident and you're really strong and you've done all the testing, and it just puts another aspect of decreasing your risk for injury, because the more boxes we can check to decrease your risk for injury, the less the ability for that and the more successful you have for return to the court. All right, guys, reason number 5, and this is the mental aspect or the confidence aspect. So a lot of the times we see athletes that they're physically ready. They do all the 4 things before. So, they got their strength, they worked on their movement, they waited more than 9 months, they done all the return to sport testing. However, they still think they're going to re-injure themselves. So mentally, they don't match up with their physical aspects. And there's several questionnaires that we can ask to get more of the mental aspect of it. But the big thing is when you're already thinking of re-injuring your knee, that changes your movement patterns and that increases your risk for injury. So with that comes, it's like, oh, I don't want to really load my injured leg, so I start loading my uninjured leg, and that's when we have issues with tearing their opposite ACL. So that's a big reason where we tell people is not only is there a physical recovery, but also a mental recovery as well. So you really got to make sure you are believing in your abilities for your knee to perform at that level that you want to perform, and we have to match it up with your physical contributions or aspects of it. So if your mental aspect, contribution is low, meaning you're not confident, and your physical ability is very high, you're performed well, that's a risk for injury. Another thing is if you're too overconfident and your knee's not strong enough, not able to do the return to sport testing, you need to pass them, then that increases your injury. So you want to be at leveled with your physical and mental aspect and slowly raise it up together. That way you get back onto the court as safely as possible. In order to decrease your risk for returning your ACL or returning the other side is you really focus on getting your strength testing done, get that 100%, really work on the movement, the return to sport testing, the mental aspect, and also waiting the timeline. But throughout this rehab process, a thing that you really also have to work on is working on the non-injured leg. A lot of people don't really pay attention to it as much, like, oh, it's already strong enough, but that's like we mentioned before. A lot of people don't pay attention to it. That's why it gets a little weaker. So that's why when you compare it to the uninjured leg, it's not a true form of testing because that leg just got weaker. So really make sure you're paying attention to it because that's going to help decrease your risk for tearing that one. So like I said, a lot of the times people re-tear the same ACL, but most of the times they tear their opposite ACL. One, they're scared maybe of loading the injured leg, or the opposite leg just didn't get trained enough. So those are the things that you have to be working on to decrease your risk for re-injury. Hopefully you guys like this video. If you guys have any questions, comment below. And if you guys want to work with us, we work with a lot of ACL athletes. Send us an email. We work with athletes in Southern California area and Los Angeles and Orange County area. We also work with athletes online with online programming. And I hope you guys learned a lot. Hit the like button, share this video with friends and family, hit our subscribe button, and we are the Basketball Doctors. Let's ball for life.